This 13-year-old patient was referred to me for endodontic treatment of tooth number 30. Someone else, a year or two ago, had already started the root canal and I guess couldn't finish it. I didn't know. It looked like the it looked like the pulp chamber was intact, right? That's the pre-op x-ray. Looks like the pulp chamber is intact. There's a filling in the tooth, and mom brought him to us and said sometimes he complains of a toothache and sometimes even a headache. And he was seen by his dentist, and his dentist said, "Oh, looks like there's an abscess here, and looks like this tooth is not an easy one." So patient was referred to me. So today we went ahead and sedated him and did this root canal in one appointment. Once I removed this part of this filling, there was actually, they had done a pulpotomy. So there was a cotton pellet with formal. I could smell the formal in the pulp chamber. But here, looking at the tooth, it looks like the pulp chamber is intact, and perhaps maybe a little pulp exposure, but doesn't look like the pulp chamber was accessed. But of course, when I got inside of the tooth, I was surprised to see that there was a huge cotton pellet in the pulp chamber, and it smelled like formal. Anyways, necrotic pulp. So take a look. This is mid-op, just to make sure that my lengths were okay, because I was going to place the permanent buildup as well. So before I filled the rest of the canals and placed the permanent buildup, I just wanted to make sure my lengths were okay, and as you can see, the lengths are good. That's another angulation. You can see the lengths are good, and look at this beautiful curvature here. 2 mesial canals and 2 distal canals. And take a look here. This is the final result. As you can see, everything went beautifully. 2 separate mesial canals. Look at the distal root anatomy. Look at all of this. Look at all this anastomosis. And 2 separate apical exits. And we went ahead and placed a permanent buildup as well. It's just another PA, another angulation. Again, you can see the 2 mesial canals and the 2 distal canals. In this angulation, you can appreciate the curvature of the distal root. Look at that. Again, you can appreciate the curvature of the distal root, the 2 mesials. And as I said, everything went beautifully. And we placed a permanent buildup as well.